Hello, everyone. My name is Dr. Maria D'Souza. I am a geriatrician and the medical director of the JFS COMPASS program at Jewish Family Services of Delaware. And I'm thrilled to be able to share information about our program with you today, along with my colleague, Kate Gruber, who is our social work care manager. So without further ado, let me share my screen and we'll start the presentation. Okay. So a brief overview. I'm going to tell you a little bit about our organization, an overview of our approach to care, just touch on caregiver stress and needs, and then get into the nuts and bolts of our program before turning things over to Kate. So the COMPASS program is a program of Jewish Family Services of Delaware, which has been strengthening individuals, families, and the community for over 120 years by providing counseling and support services. And a question that we are frequently asked is, do you need to be Jewish to access services at JFS? And the answer is absolutely not. We serve people of all different faiths, backgrounds, walks of life, etc. But it's a common question. We invite you to visit our website to learn a little bit more about other older adult services that JFS offers in addition to the COMPASS program. And now on to COMPASS, which stands for Caring for Older Adults with Memory Problems and Their Support Systems. And the mission of the COMPASS program is to provide specialized medical care for older adults with dementia, and just as importantly, critical support for their caregivers, including education, counseling, and improved access to services, with the overarching goal that families affected by dementia in our community will receive the care and support they need to navigate the challenges brought on by this devastating disease. And we strive to do this with a spirit of service and compassion. So one of the things that really pains me is it's remarkable how many people think that there's not much to do because dementia is terminal and because there is no cure yet, that there's not much to do. And that couldn't be further from the truth. There are absolutely many things that we can and should be doing to improve the quality of life of both the patient and their loved ones. And this approach is known as comprehensive dementia care management. And it is a proactive approach to assessing and providing supportive care across multiple domains that I've listed here. So regularly assessing somebody's cognitive function so that we can provide the right supports, whether that be medication or non-pharmacological strategies. Assessing someone's function, their ability to go about their activities of daily living. And again, referring or recommending supports as appropriate. Illuminating the stage of the person's dementia. That is so important to help families understand where in the trajectory of the disease their loved one is and what to expect. So that is a critical piece of care as well. Providing guidance about decision-making capacity. Families are often very stressed about, can my loved one continue to manage their finances? So assessing and providing guidance there. Screening for and managing the behavioral and psychological symptoms of dementia. I can't stress enough, this is really one of the most stressful aspects of life for caregivers, the toll that behavioral symptoms take. And I'll touch on this a couple more times during the presentation about how we manage those. Screening for and treating depression, screening medications regularly. As Cindy mentioned, there are often multiple doctors and so forth, so it's very important to ensure that there are no interactions between drugs or drugs that are impairing cognition. Assessing safety across multiple domains, whether it's home safety, falls prevention, driving safety, financial vulnerability, medication safety. So proactively assessing all of those. Advanced care planning, helping people to assess their healthcare preferences, advanced directives, et cetera, and plan for future needs. Connecting people with elder care attorneys, et cetera. And finally, caregiver identification and needs assessment. I've bolded that because at the COMPASS program, we place a lot of emphasis on this area because it's so hard to make headway on any of the other domains without identifying and supporting that caregiver. Which leads me to a concept that we really strive to emphasize with our COMPASS caregivers who are so often self-sacrificing in their quest to provide the best care that they can for their loved one, is that the health and well-being of your loved one is strongly dependent on how well you are supported and equipped as a caregiver. So again, that whole, put on your own oxygen mask first analogy is absolutely true. And we try to help our caregivers understand that and help them take care of themselves. So just briefly to touch on caregiver stress, this is a formal construct, a well-recognized construct that caregivers, particularly caregivers of individuals with dementia, experience high rates of emotional, financial, and physical difficulties. We know that caregivers often experience exacerbations of their own chronic health conditions. They may have high rates of depression. There's a lot of stresses going on, let me just say that, and also rewards of caregiving. I don't want to be all doom and gloom, but in light of the known stresses of caregiving, what do caregivers need? Disease education, helping people to understand why their loved one is behaving the way they are. That can go a long way to helping caregivers cope better. Providing information about services and resources that are available that may be helpful and connecting people with those. Skills training, so communication strategies specific to dementia, as well as tools for managing behaviors. And even the skill of self-care is something that needs to be honed for caregivers. And finally, support. Caregivers need emotional and psychological support, social support, practical support, respite, etc. So about our model, again, we provide dementia-specific medical care and caregiver support throughout all stages of the disease. And we take a holistic and family-centered approach. We have multiple family members join our appointments in many cases from different places. Telehealth has made that even more doable. We are an interdisciplinary team model, and our team meets, we're in constant communication, but we formally meet weekly to discuss ongoing issues with our patients and families. We are a consultative model, which means that we don't provide primary care. Patients continue to receive primary care from their primary care physician, but we collaborate very closely, and we're in close touch with those physicians and specialists also. We provide personalized care planning and care management based on individual values and preferences. And I think that's important to emphasize as really the crux of our program, that we really understand that it can be so difficult for caregivers who are in the weeds of caregiving to really move forward on various needs. And so we really provide that handholding and helping people to make progress on recommendations that we may have arrived at together for their loved one's care. We provide comprehensive wraparound support, as one of our caregivers termed it, which means that we are really assessing what are the needs in the whole picture, and we strive to meet them, whatever they may be. And finally, we strive to be accessible and responsive to concerns as they arise. So here is a brief snapshot of our team. Myself as the geriatrician, Kate Gruber is our care manager. We're supported closely by Beverly Kurzhals, our administrative assistant. We are the core COMPASS team, and we're supported by a sort of second layer of professionals at JFS, including nurses, therapists, our older adult program managers, and others. We have a psychiatrist. So we really have layers of team, and even outside of the agency, we partner with various entities who we consider part of our broader team. So how does our model operate? So on the medical side, we schedule an initial in-depth assessment when a patient enrolls in the COMPASS program. Leading up to that, the care manager is in touch with the caregiver to get background information, start to hone in on what are the pain points, what are the priorities at hand, and develop rapport, et cetera, so that we can really hit the ground running at that initial assessment. The patient is not required to participate for the full 3 hours. That can, of course, be difficult for many people with dementia. We have a block for dedicated private interview with the caregiver to gather information, review the history. And then when we do involve the patient, we perform cognitive testing, exam, etc. And then we circle back with the caregiver to really formulate the care plan, perform that initial education and strategizing. Follow-up visits are then about an hour in length, and the frequency varies from weekly if somebody comes to us in crisis to every few months if the situation is stable. Every appointment includes ample time for one-on-one caregiver interview and individualized education. And after every appointment, we're closely coordinating with the other physicians and specialists. Again, that coordination piece is so key to make sure that the patient's whole care team is on the same page. So I'm often emailing or calling other physicians to make sure of that. On the caregiver support and care management side, caregivers receive at minimum a monthly check-in call from our care manager, and they're also encouraged to reach out to us as concerns arise. We really do want to be as accessible as possible to caregivers. What's happening on these calls, the care manager is assisting the caregiver to prioritize and implement the care plan goals, providing assistance with problem solving, issue-specific guidance, skills training and coaching, and that emotional support, helping caregivers to focus on their self-care. So again, the behavioral symptoms. Over 90% of people with dementia will experience one or more behavioral symptoms during the course of their disease. That ranges from things like hallucinations and delusions, to agitation, resistance to care, compulsive behaviors, lots of different things that can be very distressing. And our approach prioritizes non-pharmacological approaches as first line, which is very time intensive, but we really want to teach caregivers how to apply frameworks to get better at this. And we do provide prescriptions for medications when they are indicated, and certainly they are sometimes, and we do that as well. This is kind of a busy slide. I'm not going to go through all of it. We will provide these slides, by the way, on our website. I'm not sure if they're being provided on the Expo website, but you can visit our website to revisit the details, but just an overview of the various types of interventions that we provide. So who is eligible for our program? Anyone with a probable dementia diagnosis. A formal diagnosis is not required, as we can perform the diagnostic assessment upon enrollment, and we can help screen referrals for appropriateness. Patients must have an involved caregiver, again, because of the nature of our program. The caregiver must accompany the patient to all appointments, and the caregiver doesn't need to live with the patient or be a relative. Patients can live at home or in a facility. We accept patients from all over Delaware and the surrounding region, and referrals are accepted from family members and professionals. The costs of our program. The medical care is covered by Medicare and other insurance for the patient. The comprehensive caregiver support that we provide is covered by a caregiver services fee that we charge. That's frankly nominal. It's less than a cell phone bill in many cases. It's $55 a month, and there is financial aid available for those with need. And we still have to rely on charitable funds to provide these services in the community. To make an appointment or referral, simply contact Kate. There's also a referral form on our website. And at this point, I'd like to turn things over to Kate to share her perspectives.
Hi, my name is Kate Gruber, and I am the social work care manager with the COMPASS team. My focus is on caregiver stress, caregiver support, and self-care. And I'm talking with the caregivers one-on-one to talk about their stress levels, what they're doing for self-care, and making recommendations for addressing caregiver stress. I'm also working with the caregivers to move forward on their goals, such as enrolling in a day program or finding private duty. And I also provide referrals for caregivers to the community resources, such as counseling services, respite care options, and home health care. As we know, these resources are very helpful to caregivers and their loved ones, but may be very hard to identify and navigate when the caregivers are already have so much on their plate already. And regarding referrals, when the COMPASS program gets a referral, I'm in contact with the caregiver to review the program in depth and spend time hearing about their situation, their loved one's background, and just get an idea of the stressors and issues they are facing. And also during that call, we are strategizing about the first visit because it may be difficult for the caregiver to get alone time with Dr. D'Souza to really, discuss what they're going through, and also may be hard for their loved one to agree to talk with the doctor. So we strategize about that ahead of the visit. While we are not a 24-hour-a-day service, we do strive to make ourselves very accessible to our caregivers because we know that caregiving is a 24-hour-a-day job. And we encourage them to reach out to us in between visits if they're feeling overwhelmed, if there is a new behavior or a worsening of a behavior, if they need to vent, get emotional support, or if their loved one has gone to the hospital. So I'm here to offer interventions and responses to those behaviors, and in some cases offering an emergency telehealth visit within a few days with the COMPASS team if there is a hospitalization or an unsafe situation. So thank you all for attending this, and we really like to, we enjoy getting the word about COMPASS out there. So I'll turn it back to you, Dr. D'Souza.
Thanks so much, Kate. We'll just wrap up and be happy to answer any questions in the Q&A. Thank you, everyone.